We're back. Happy 2026. I know that we are in February, which is Love Month, but I know and trust that you all will enjoy today's Women's Wellness Journey guest. And just a little bit about Women's Wellness Journey. It is the first Tuesday of every single month. We just took the guesswork out of it, so you never have to remember when it is. It's the first Tuesday of every month. You can go to selfcareuniversityok.com and find it, or you are welcome to find us on Facebook. I do want to introduce this lovely lady, Tamara Walker. I want to tell you all about her, so that way you understand this information that you're getting. This is quality information. Well, let's just get started because we have a lot to talk about. So Tamara Walker is a speaker. She's a radio and television personality and a former registered nurse who now serves expectant and new parents as a birth boot camp certified childbirth instructor. Ooh, I love a good long title. So, what about an instructor, birth, and postpartum doula, and the owner of Mom RN Birth Services? She's been online since 2001. She has an alter ego, Mom RN, and she is providing practical information and advice for raising a happy, healthy family on momrn.com. She hosted and produced the Ask Mom RN show from 2004 to 2018, where she shared parenting and health information, advice, and support. Ooh, I want to know more about that. The Ask Mom RN show, it reached thousands of parents across the world, and it featured interviews with expert guests and many celebrity guests. So Tamara lives in Edmond, Oklahoma with her husband, and they have two grown sons and two grandsons. She is passionate about educating and supporting expectant and new parents and connecting with other birth workers. So you can connect with her at momrnbirthservices.com. We're so excited you're here.
Thank you. I appreciate you having me on. I'm excited to join you and excited to talk about um, all things birthy today.
Let's go.
Okay, so I am Tamara Walker. I am a birth doula and a childbirth instructor. I certified about a little over 4 years ago, about 4.5 years ago. But labor support is something that I have done for over 34 years now. For friends and families for about 30 years before I ever became certified. But I'm also a former registered nurse, and I wasn't in labor and delivery, but I was in pediatrics and occasionally got to go to labor and delivery, was in on many births. And birth is just something that I think is magical. I think it is something that is like no other experience in the world when you are bringing into the world this new life. And it is such a journey and adventure like no other. And so, my goal as a birth worker, as a doula, as a childbirth educator, is to help parents as they are going on this adventure, on this journey of how to navigate that experience and how to make it the best that it can be. Because we all know that sometimes pregnancy, labor, birth can seem really nerve-wracking and scary for a lot of people. It can be very anxiety producing and anxiety filled if it's something that you've never been through before, or if maybe you've been through it before and it wasn't a good experience, or there was any birth trauma involved. So, my goal is to help expectant parents prepare for and experience this adventure in the best way possible and just make it the most amazing, wonderful experience that we can. And that comes with making sure that you have the right support, making sure that you have the knowledge that you need to make informed decisions, and having the right team around you. And so today, I wanted to talk with you about what a doula is and what doulas do and how they help with creating your birth experience and supporting your birth experience, and about birth classes and the importance of birth education and how being prepared will make a better experience for you. So, my title today is Knowledge, Comfort, Confidence, Building the Birth That You Want. And it's a doula's guide to surrounding yourself with the best support for your ideal birth and postpartum experience. So we're going to dive right in to what is, sorry, there's me again. As Connie said, I am a certified birth boot camp doula and childbirth instructor. I'm the owner of Mom RN Birth Services and a former registered nurse. So we're going to dive right into what is a doula. And this is something that I get asked a lot because sometimes people have heard the word doula, but they don't really know what it means, or they have misconceptions about it, or they've never even heard. It's like, what are you saying, doula? What is doula? So doula is the word comes from Greek origin. It means with woman or to serve women. And a doula is a trained support person who is providing continuous emotional support, physical support, and informational support. And that can be during pregnancy. Specifically, most doulas are providing labor and birth support, and then also through the postpartum period. And there are doulas that specialize in different types of doula care, but generally, most doulas are providing information. They're providing emotional support. They're helping you to prepare. They're teaching you, and they are giving hands-on comfort measures. They are just surrounding you with the support that you need. What a doula is not is they are not a medical provider. So it's not the same as a nurse per se in labor and delivery who's actually doing clinical tasks, or your OB or a midwife. There's a very common misconception that doulas and midwives are the same thing. And that is simply not the accurate. It's more as we are working alongside each other, but doulas also work alongside OBGYNs. And we are not doing the medical tests and clinical tests. So we're not checking the cervix for how much a mom is dilated or where baby is, what we call baby station in the pelvis during labor. And we're not checking mom's blood pressure or temperature or any of her lab work or anything like that. We're not doing those medical tests that an OBGYN or a midwife would do. So we're working in conjunction with them and in collaboration, but we're offering different services. And our goal is to help you feel confident and informed and supported. And a doula's role is to not just during birth, but during your pregnancy, during your postpartum, even throughout that time period to help you get the support and info that you need. So, other things that a doula does is to help you understand your options for birth. So, while you are pregnant and you're trying to decide what type of birth experience do I want? Do I want to have an OBGYN? Do I want to give birth at a hospital? Do I want to have a midwife? Do I want to give birth at home or at a birth center with a midwife? Do I want medication during my labor? Do I not want medication during my labor? Do I want certain interventions? Do I want certain things for my baby when baby's here? Those are all kinds of decisions that through your pregnancy, you're making these choices and these decisions. And a doula is helping you to make sure you've got the information you need to make informed choices and helping you kind of process through and decide what is best for you. And whatever you choose, then she's there to support your options and your choices. And she answers questions. She provides evidence information. Ideally, your doula should be doing that and helps you to prepare a birth plan. She also typically will teach comfort measures and coping strategies for labor and help to prepare you and your partner and offers reassurance and emotional support. So I would say one of my big jobs as a doula really tends to come down to um, not only the physical support, but really helping to reduce anxiety, helping to take away that fear and turn it into excitement and anticipation of this adventure that we're going on, and to help my clients to process information that they're getting from their healthcare providers and deciding what they want to do and what is best for them and for their babies. And so during labor and birth, your doula should offer you continuous presence. So typically what that looks like with my clients is when they are in early labor or they think that they're going into labor, we are communicating by phone. They're calling me, they're texting me, we are staying in touch. And then once they are needing my presence in person, then I go and join them to help them in person. And we are, um, talking throughout the weeks leading up, sometimes months leading up to their due date, depending on when they hired me within their pregnancy. So we're continuously having contact during the pregnancy, off and on, as they need. And then we are meeting before they ever give birth to go over things and help them create their birth plan and to prepare. And then during labor and birth, I am there for them and supporting, guiding them, helping them, and offering those comfort measures and emotional support as well. A doula also suggests positions for mom to get in during labor and birth to try to optimize her experience and to optimize baby being able to move down during labor, and breathing, helping mom to remember to breathe, to try to relax her body, to take away that fear again with deep breathing, offering comfort techniques, hands-on support such as counter pressure, massage, heat and cold, hip squeezes, so many different things that we can do to help mom physically and helping to support the partner, because partners get very anxious sometimes when they see that this person they love is in pain or having contractions, and they if they haven't been prepared on how to help with that, they sometimes they're just sitting there feeling very helpless and maybe not really engaged because they're just like, I don't know what to do. I don't know how to help. It can be distressing for them. So prior to ever giving birth, we want to prepare partners to make sure they know what to do, how they can help, and that they can be on hands-on support and help and be a part of this experience, because it's their experience too, bringing this baby into the world. This should be a great experience for them as well. And so when they are supported and when they are informed, they can help mom better. And so tag teaming typically during labor, me and the husband or partner, we are um, tag teaming, and sometimes we're both at the same time taking care of mom. We're both taking care of her, whatever her needs are. But other times, maybe dad needs a break, maybe needs to go off and go to the bathroom or get something to eat, or just needs to rest if it's been a really long labor. Um, and so we are, working together as a team. and then helping to communicate preferences with your birth team, your care team, helping you to speak up for yourself and communicate what you need, what you want, what your birth preferences are, what your birth plan is. So a doula can facilitate that, help with that communication. Personally, as a doula, I am not typically speaking directly to the staff on my client's behalf. I'm not speaking for my client unless it's something simple like, could she have another pillow or another blanket? But if it comes down to she's making decisions about an intervention, whether she wants potentially to have her water broken, or if she wants to have an IV or pain medication. I'm not telling the staff this is what the client wants. I'm helping the client and her partner speak up for themselves and to advocate for themselves. I'm helping to facilitate and communicate with them and help them to talk with the staff. But my role with the staff is just helping to make sure that they are aware of your care preferences and we're all working together and collaboratively in the care. And so a doula also helps to support a calm and grounded environment to try to help make your labor and birth experience a little calmer, more relaxed. Sometimes if you're having a hospital birth, that environment is not as much as in your control as if you were at home giving birth. And so a doula can help to, change the lighting, dim the lighting, change the temperature in the room if need be, make sure you're warm enough, cool enough, um, keep things calm, try to limit people in and out as much as possible, and just help you to stay focused and calm and grounded. So during postpartum, a doula can also help with supporting however you're going to be feeding your baby, answering questions, helping to facilitate that first breastfeeding session, or if you're going to be bottle feeding, just helping you to get started, helping you with newborn care basics and learning those, and providing emotional support for that transition home when you've got this brand new baby and typically you are really tired and worn out because maybe it was a long labor. And even if it was a short labor, sometimes it can be just very tiring and taxing because it's a very physically demanding experience. And so you're tired, you're sleepless, you've got this brand new baby to take care of. It can be kind of overwhelming. And then on top of that, you've got all these hormones going through your body that are changing and everything's different. And so sometimes that transition home can be a little nerve-wracking or just tiring. And so providing that emotional support, helping you get through that time of transition, those first few days home, those first few weeks, a doula can really help a lot with that. And there are postpartum doulas also that can be hired to actually come into the home to help provide care for mom and baby and the family in general, and just try to help support that transition and in those first few weeks. Um, a postpartum doula can also help, or even your birth doula can do some postpartum follow-up and help with postpartum mood concerns and help screen for any postpartum depression or anxiety that might need to be referred, that you might need to follow up with your either your healthcare provider or connect you with resources of um, people that can help you. And so sometimes a doula can pick up on those things and help to figure out, okay, I really feel like it's a good idea for you to talk with your healthcare provider. There might be some, the potential of some postpartum anxiety or some postpartum depression that could need some care and need some treatment, and helping to encourage that client to get some help. They also help you rest and recover and adjust. And so doulas do so many things throughout pregnancy, labor, birth, and postpartum. And choosing your doula, if you decide that you want to hire a doula or you want to look into having a doula, I really encourage you to ask around and research for, who are the doulas that are most recommended in your area. You might want to ask your healthcare provider, whether that's your OB or your midwife, do an internet search. And another great way to find one is to ask around in moms groups on social media, especially Facebook. There's a lot of great moms groups, and it seems like almost daily somebody's asking for doula references. And so check out those, find a few to interview. I always recommend interviewing at least three, just so that you can get an idea and feel for which one is going to be the best one for you. You want a doula who meshes with your personality because we all have different personalities. We all have different ways of how we uh, teach things, how we do things. And so you want to make sure that the doula that you hire is going to be somebody that you get along with, that you feel comfortable with, who makes you feel safe and supported and cared about, somebody that you feel you can trust. Because if you hire someone and they're just not meshing, they're just not vibing with you, then it's not going to be as good of an experience as it could be. So I highly recommend interviewing three at least, and then picking who you feel the most comfortable with, who you feel is going to be the best one for you. Come prepared when you interview those doulas. Have questions for them about what you want to know, what's important to you. Um, if you know what type of birth experience that you're ideally working towards and what you want, what you've visualized, share that. Make sure that they're on the same page with you of how they support and what they support, and that's going to help a lot. And then trust your instincts. Like I said, you want to make sure that this person meshes with your personality, makes you feel that you're safe and that your desires and needs for your birth are supported. And if they don't, then you need to keep looking. And it's very important to know that most doulas will support if you are choosing medication for your labor and birth. But there are some doulas who really only want to focus on natural birth or unmedicated birth, what we call natural birth. Um, if you are somebody who is thinking, I might want an epidural or I might want pain medication, then you want to hire a doula who's going to be supportive of what you choose. And you wouldn't want to hire a doula who's not going to be there for you if you decide, well, if you get an epidural, then you don't need me and I'm out of here. Thankfully, those are few and far between, but unfortunately, I've heard of it happening. And so make sure that your doula is on the same page with you about what you want and supportive of what you choose. She shouldn't be imposing her um, beliefs and thoughts on everything onto you and pushing you towards certain decisions. She should be informing you and helping you to decide what you feel is best and right for you. And so I always tell my clients that um, my goal is to just make sure that they're informed of here are what your options are, and here's the risks and benefits of all of these different options. And here's where some of these can be helpful. Here's where sometimes you've got to beware and be aware of some of the risks. And then you make the decision of what is best for you. And I'm going to come in and support that and help you through that. And so making sure you've got a doula that's on the right page with you and understands your wants and needs is so important. Other factors to consider when you're choosing a doula would be location and available options. So you may have in your area only a few doulas, only one or two doulas, or you may have a plethora to choose from. So, depending on where you live, is going to help kind of determine how many options you have and how many you get to choose from. And then you want to know again, where are these doulas supporting birth? You want to make sure that the doula you choose, if she is more of a home birth doula and I only support births at home, but you're planning to give birth at a hospital, then she's not going to be the best choice for you. If she's primarily, I only want to support hospital births, I only want to support births with medication, but you're planning an unmedicated birth, maybe you're planning a home birth or a birth center birth, she might not be the right choice for you either. So making sure that she is supportive of what you're choosing and that's where she is going to, be able to support you. And then also low risk or high risk pregnancy. If you are high risk pregnancy, it would be helpful if you find a doula who specializes in that or at least has experience in dealing with clients who have had high risk pregnancies. If you're low risk pregnancy, then that's less of a concern. But anyone that has a high risk pregnancy may want a doula who has some knowledge and insight and can help if she's had experience supporting high risk pregnancies. Also, insurance coverage. More and more insurance companies are coming to the realization that having doulas helps reduce costs. And so they are seeing the benefits of doulas, and many more insurance companies are coming to that realization of, okay, we're going to cover doula care. So I always tell prospective clients and students, check with your insurance to see, do you have coverage for a doula? I'm not contracted directly with the insurance companies. Some doulas are in different areas, um, but sometimes my clients or students can get reimbursed through their insurance policy. They pay me and then they get reimbursed from their insurance if their insurance covers doula care. Also, if you have HSA or FSA funds, some of those policies will allow you to use those funds and get reimbursed for doula care. So, looking into alternate ways to fund a doula. Also, you could put doula services, doula care on your baby registry and have people give towards that as a gift instead of, um, you know, diapers or baby outfits or, bottles or bassinets or, that would be another gift option that could be very, very helpful for you. And so they can give towards that. So, what are the benefits of having the best doula for you? Having continuous quality support can increase your comfort, can reduce your anxiety, can improve birth outcomes and experiences, and can reduce your risk of perinatal mood disorders. So there's so many benefits to having a doula, and the research shows that there are so many statistical, proven, researched, evidence-based benefits to having a doula, such as a 39% drop in cesarean births thanks to steady doula support. So when clients have a doula, it doesn't mean that we can guarantee that you're not going to have a cesarean. Unfortunately, we don't have that control. I wish we did. But it does reduce your risk of a cesarean. A 15% rise in spontaneous vaginal birth, meaning doesn't need to be induced or not having an induction. So 15% rise in spontaneous vaginal birth with emotional and informational care. A 22% reduction in preterm births because doulas do help promote healthier pregnancies. Again, we can't guarantee any specific outcome, of course, but helping to give that information for our clients and helping them work towards healthier pregnancy helps keep them lower risk, or even if they're high risk, helps kind of try to minimize some of that risk and can help reduce that risk of preterm birth. Also, a 10% decrease in the use of pain medications. And that's typically because we're offering, again, that continuous physical and emotional support, giving you that preparation and that confidence. And so it may reduce the need for pain medication. And if you are choosing that you do not want pain medication and you want to have an unmedicated birth, then that's going to really help you having a doula to work towards that and to be able to prepare yourself and be able to maximize your chances of having a great birth experience without medication. Um, and if you're choosing to have medication, or if you get into labor and decide, okay, I've changed my mind, I want medication, perhaps you can get that later than you might have earlier on in labor, might minimize what you need and how much you need and for how long during your labor because you've had other ways of dealing with the contractions up until you decide, yes, I want medication. So there is that decrease in that need for medication in a lot of clients. So there's lots of benefits to having a doula. So, another factor in having a great birth experience and preparing for your labor and birth journey is taking a birth class. And I am super passionate about birth education, even more so than doula support, because I love, love, love making sure that my clients and my students are prepared, that they've been given the information they need, that they've had their questions answered, that they feel confident instead of anxious and scared, and that they are going into their birth with this knowledge and this confidence. So, why is it important to take birth classes? Birth is unpredictable, but preparation reduces fear. Birth is a lot like, life. And life, as the old saying goes from, Forrest Gump, if you remember that movie back in the day, life is like a box of chocolates. Well, labor is very much that way too. You never know what you're going to get. And so, knowing that labor and birth can be unpredictable, we want to be prepared as possible. And that way, we're not going into it with a lot of anxiety and fear. We're going into it having already learned and having already thought about, okay, if this happens, then we want to do this. Or if that happens, we're prepared, we understand, we're not being blindsided by everything. And so that knowledge also increases your confidence. You're going into that birth feeling much more confident. That confidence supports relaxation. It also supports feeling more satisfied because you're taking charge of what you want in what can feel like an uncontrollable situation sometimes. But even when it's unpredictable, you've still got the information you need to be able to make informed decisions. So you feel a lot more satisfied with how your birth experience went. And so we want to make sure that you're prepared. And preparation, like I said, also helps your partners feel involved and ready. Um, this is their experience too. Want to make sure that they are learning right alongside you and ready to support you and help you and be able to enjoy this experience as well. And how do classes improve birth outcomes? The research shows that birth education can lead to, like I said, lower fear and anxiety. That's a big one. More satisfaction with your birth, fewer unnecessary interventions. And that's a huge one. If you're getting a comprehensive class education about all of the different interventions that are typical especially if you're having a hospital birth. There are lots of interventions that are possible. Being aware of what those are and what those risks and benefits are so that you can choose what you want for yourself and what you feel is best for you and your baby. Um, Sometimes those interventions are necessary and they're great tools. Sometimes they're used unnecessarily. And sometimes that can lead to poor outcomes or just not feeling like you had a very good experience. And so we want to reduce those unnecessary interventions, and birth education can really help you to do that. Having more confidence going into your postpartum, knowing what to expect, preparing for postpartum. A lot of times birth classes focus so much on labor and birth, maybe not really talking so much about postpartum, but we really need to be preparing moms for postpartum as well and families to get them ready for, okay, what happens after you've given birth and taking care of this baby, taking care of mom because mom's recovering. And so, again, better partner involvement to help throughout that whole process. So, birth outcomes are greatly improved when parents have birth classes. So, choosing a birth class for you, factors to consider. Again, research and referrals. Ask around. Ask your friends, ask your OB, ask your midwife for recommendations. Do an internet search. See what available options are in your area and ask in moms groups. And there's lots of different types of classes out there. There's lots of different choices in a lot of areas. I recommend a comprehensive birth class because comprehensive will help you to have more information, better prepare you for pregnancy, labor, birth, and postpartum. Um, for example, in my classes, I teach classes through Birth Boot Camp, and in our classes, we talk about all of your options. Whether you're wanting to give birth in a hospital or planning to give birth in a hospital, whether you have an OBGYN as your care provider, or whether you have a midwife as your provider, whether you're choosing to give birth at home or in a birth center, whether you want medication or you don't want medication, what are those options? What do they look like? What are all the comfort measures? And in my class, we teach a plethora of ways to cope with labor, different tools, resources, ways to help you so that it's not just a one and done. So that's important to look for in a class. Um, Making sure that the style of class that you choose fits what you are wanting for your birth, and whether it's in person or whether it's online, whether it fits your schedule. And then the format of the class, just choosing those logistics of what's going to work for you, finding a class that's going to fit your needs and fit your schedule, and make sure that it is, um, again, informing you and preparing you as greatly as possible. I always say that the reason I chose to teach with Birth Boot Camp is when I looked at different options for birth education and looked at different organizations. The thing that I loved with Birth Boot Camp and their classes and teaching those is that we are providing all the options. We're providing evidence-based information, up-to-date information. Our curriculum is reviewed every year and updated very frequently. We are continuously, every year, we have to renew our certification. So we're continuously doing education for ourselves as instructors. And we are not just a one and done. We're not just focused on unmedicated natural birth. We're not just focused on medicated birth. We're not just focused on home birth. We are focused on providing all of the options and then going through that evidence-based information and making birth learning fun. It's very important to me that my students enjoy our classes and that we make it fun. We have activities we do. We have a great time. We learn a lot, but we have a lot of fun too. And so we also teach a lot of comfort measures because we want moms and dads to have what they need when they need it. And sometimes what worked for you in early labor may not work as well for you in late labor. You might need to use different tools or coping mechanisms. Knowing that you have lots of options is going to help what we call fill your toolbox so that you have lots of different things to choose from. When I was giving birth with my first child, we took a birth class, and I used a midwife and a birth center, and and we had a good birth class, but I will say that one of the only ways that they really taught, they taught a few comfort measures, but one of the biggest things they taught was a breathing technique. And it was, something along the lines of ha ha, he, ho ho, this way of breathing. And, I thought, oh, that's going to help me. That's going to be, oh, that's going to be so helpful. I went so far as I made my husband a t-shirt to wear while I was in labor with paint markers, fabric paint with the pattern, the breathing pattern written out on his shirt. Guess what didn't help me during labor? Not a bit. It just went out the window. It just, that was not useful for me. I'm sure it helped many other people. It did not help me. And then I was scrambling for what's going to help me. How do I cope? So our goal is to give you so many options that you've got lots of ways to help. And then when you couple that with a doula, she's going to have lots of ways to help you. And your partner's going to be prepared because he's taken a birth class and you've got a doula helping as well. So many reasons to take a birth class. So doulas plus birth classes are going to help you be calm and prepared, be supported at every step, and be confident and help you make informed choices. And then you get to decide what's right for you, what's right for baby, and feel like you have the support that you need to help you um, get through that and to have the best experience that you can. So, question time, and I'm going to show you my class. Sorry, the way to connect with me, and then we'll answer questions if anyone has questions. But I would love to connect with you. So, my website is momrnbirthservices.com. Got a QR code if you want to just scan that, it'll take you right to it. And on Facebook, it's Tamara Walker dash Oklahoma birth and postpartum doula, childbirth educator. So if you just search my name and search Oklahoma birth doula, it should come up. And I would love to connect with you. Feel free to contact me if you have any questions after you've watched this. Or if you are interested in doula services or birth classes, I do have, if you're not in Oklahoma in my area, then I do have virtual options and I have online options, and I would love to talk with you and help you. Or if you're looking for somebody in your area, I know doulas across the country, and if you are wanting in-person support in another state, there's a possibility I might be able to give you some recommendations. So please contact me. I'd love to talk with you. So, Connie, is there any questions that anyone has had?
Yeah, you've had some questions rolling in, and so
Oh,
um,
wonderful.
let's just if you want, I can just you can leave that information up there if you want, and then I'll just I can read the questions if you'd like. Um, Someone said, can you see them? If you hit the little chat box, it'll pop up. You can see
Yes,
it
let
too.
me
You
pull
can
up
answer
the
the ones you want,
chat.
or I can, yeah,
Okay.
little chat bubble. Do you see all those?
Oh my, okay.
Yeah.
Let's see here. Let me scroll up. So, what made me feel called to support families? Well, That's a great question. So, like I am a former registered nurse, and during nursing school, I got to see some births, hospital births. But then I also had the great opportunity my senior year of nursing school, our what they call these days, they call it a capstone project, but back then it was just a research project for our senior nursing project. We had to choose a non-traditional form of nursing to do our research project on. And I was connected with some wonderful nurse midwives who had a freestanding birth center in Del City, here in Oklahoma, and they were amazing. And I was honored to be able to shadow them, learn from them, get to be in on some births with them. Absolutely just fell in love with the way that they did pregnancy care and labor and birth and postpartum care. And so I had decided, okay, when I have children, I'm going to them. That's what I want. And I saw the dramatic difference between hospital births and births with midwives at a birth center. And that just, for me, that was the right choice and felt right for me. Um, but because I had had experience getting to be in on some births, then I had friends and family members who started asking me, will you be my labor coach? We didn't even, back then, we didn't really, nobody was talking about doulas. I don't even remember if I'd heard the word doula, as much as just, labor coach. Will you be my labor support person? And so I had the great opportunity over the past 34 years now, for lots of nieces and nephews and for friends who had babies to get to be their support person and get to help them while they were in labor and giving birth. And so a few years ago, I decided to certify as a doula and a childbirth educator. And initially, back when I graduated nursing school, I had thought someday I'll go back to school, I'll become a certified nurse midwife. But God had other plans, and
Mhm.
I've had the great opportunity to do other things and throughout the years. But a few years ago, I had lost my job during the pandemic that I was doing at that time and decided, okay, do I go back to school? Do I become a nurse midwife? Or what do I want to do? And the more that I thought about it, the more I realized that it wasn't necessarily the um, clinical and medical tasks that I am most passionate about doing. I love the caregiving, the informational side of it, educating, providing that care, that nurturing, supportive. It just, that's what resonates with me the most and what I get most passionate about. So I decided that being a birth doula and a childbirth educator was the right choice for me. And I've just absolutely loved serving parents in that way. So, and then for women who are pregnant for the first time, what is the one thing you wish every mom knew before labor even begins? So absolutely. The number one thing I always say is take birth classes. You don't know what you don't know. And time again, when I've heard moms say, oh, I'm just going to wing it. Women have been given birth since the beginning of time, and and I'm afraid that classes are just going to scare me more, and I'm just going to, I trust my doctor, and I'm just gonna wing it. And inwardly it makes me cringe and it makes me very
Mhm.
concerned for them because I know after talking with so many parents that those births don't always go the way that you want them to go. And when you're in the throes of labor and you're dealing with contractions, and then you're being confronted with decisions that maybe you've never had to think about before or have any clue about because it's not something that if you've never had a baby, you've never really had to know it before, So it just, you don't know what you don't know. But then if you're having to make those decisions and you've never had the information given to you, you've never had time to think about them, sometimes you make decisions in labor and then later maybe look back if it wasn't a good experience and wish that you had had the knowledge to make different decisions so that you could have had a better outcome, a better experience. And so I always say, take a birth class. Number one thing, take birth classes, prepare.
Love that.
So, um, feeling what actually helps women feel calm and confident going into birth. Yes. So like I said, yeah, there's a lot of fear going into birth if you, especially for first-time parents. But even, I've had second-time moms take my classes because they had a really bad first experience and they wanted a better experience. And they didn't take a class the first time, so they wanted to be prepared the next time. So again, birth classes, and if you can hire a doula, those are going to go a long way towards helping you feel confident, taking away that fear, helping you feel calm and prepared. So, can you explain the difference between a childbirth class, a doula, and hospital staff, and how each one supports a mom differently? Absolutely. So, um, like I said, a doula is not a medical professional. So she's supporting you in a whole different way. She's also not um, like the nurse. A lot of times I hear people say, well, that's what the labor and delivery nurse is for. The labor and delivery nurse is going to be in there supporting you and taking care of you. However, a labor and delivery nurse, they may have another patient in labor, possibly even more than one other patient. They are focused more on the clinical and medical aspects of your care for you and baby. They are there to try to ensure safety, to try to, take care of you. And yes, they can be calm and supportive and helpful, but they are generally not able to stay with you 24/7 and be there constantly making
Right.
sure that your needs are being taken care of and that you're staying calm and prepared and giving you those comfort measures. Most of the time, nurses are not in there giving you counter pressure on your back or massaging you or holding your hand or, doing all these things that a doula would do. And so it's just typically not possible for a labor and delivery nurse to be in there constantly while you're in labor. And also, you're probably going to be laboring at home for a long time prior to getting to the hospital. And so you want to have support before you ever get to the hospital, whether that's in person or whether that's over the phone and having that, information and reassurance and being able to text and call your doula and then having her join you in person when you're ready. And then with a childbirth class. So some doulas do a lot of childbirth education as part of their package, but some do very limited. And so there's a lot of doulas who only do very little prenatal education and will recommend that you take a class. There are some like me who are certified as both, who offer both, and I have a package that kind of marries the two. It offers your doula support, but then it also includes classes. So we are meeting for classes for however many weeks. Sometimes my patients choose I'm sorry, my clients are choosing the comprehensive class, which is 10 weeks. Sometimes they're choosing the 6-week hospital class or the 5-week home birth class. But they are getting that childbirth education as well as doula support. But not all doulas teach classes, and not all doulas offer that much education. And so it's important to know when you're hiring one what they offer. Um, I hope that that answered that question. And then for moms who want a more natural or low intervention birth, what are some simple things they can do to prepare their bodies ahead of time during pregnancy? Great question. So, wanting to have low intervention, wanting to have unmedicated, more natural birth, I say you need to start with your provider, making sure that whoever you
Mhm.
hire, whether it is a midwife or whether it is an OBGYN, that they are supportive of unmedicated birth and that they are not going to be pressuring you into pain medication, because sometimes that can happen if you've got a provider who believes that all their patients should get epidurals. So you want to make sure you've got the right provider, make sure you've got the education, that you're learning different comfort measures and relaxation techniques, that you're preparing with ways to relax your body, that you are doing healthy pregnancy safe exercises can really help. Chiropractic care, going to a Webster certified chiropractor can be helpful. Um, Prenatal massage. There's so many ways that you can help prepare your body. Stay eating a healthy diet as much as possible, trying to minimize processed food. Doing all the things that you can to try to stay low risk will help you to have the type of birth experience that you're wanting. Oh, let me scroll down here so I can see. So postpartum, there's a question about postpartum. There's a lot of moms that struggle. Yes. So a lot of babies, or a lot of challenges after a mom is had baby and is bringing baby home. In my classes, we talk about what to expect. Those first few minutes, the first few hours, the first few days, the first few weeks, and how to prepare for that and how to set yourself up to have a better postpartum experience. And so one of those ways is, recruiting help, letting people help you, thinking ahead of time of how people can help you and making lists out of, here's ways that, we would like support. Hiring a postpartum doula if you're able to do that, or if your birth doula offers some postpartum follow-up, um, taking advantage of that and using that. And then just, again, preparation, preparing, being knowledgeable, learning what to expect and how to cope. And ways that grandmothers and women who are supporting daughters or daughter-in-law health can they help without overwhelming new moms? That's a great question. I think, it's natural for us to kind of want to swoop in and save the day, or this is the way that I do it, or here's what I would do. We have to be careful sometimes, and I can say this, I'm a grandma of two, so I've got two little grandbabies that are 3 and 2, and sometimes I have to bite my tongue and just stop myself and just, I'm not the parent here and they're going to do things the way that they want to do it. But if I have ways that I can be supportive and help, and especially in, that first little bit of time when they're just overwhelmed from, like I said, they're coming home, brought baby home from the hospital, they're tired, they're adjusting to sleepless nights and taking care of baby. However that you can help, whether that's providing food, whether that's helping take care of chores or running errands for them, or, you know, um, sometimes all we want to do is hold baby, but sometimes we just need to be there and take care of some of the chores so mom can hold baby, you know? So there's lots of different ways that we can be helpful. Um, let's see, you've supported families for many years. What common myths about pregnancy and newborn care do you wish would just disappear? Oh, goodness. So, I think the myth of that if you choose medication for your birth, that somehow you're not natural or having a natural birth. That's why I don't really like the term natural birth. I use the term medicated birth or unmedicated birth because whether you're giving birth with medication, without medication, vaginally, or through a cesarean birth, you're giving birth, and that's natural in my mind. And so I feel like it's a myth that women sometimes I've had family members, I've had even clients who when they know that I didn't choose medication for my births, I had birth center births that were unmedicated, then they, sometimes fear that, oh, if they choose medication, I'm going to be judging them or that I'm not going to be as supportive of that. Or, like some of my sisters, I'm just not as strong as you. I'm like, strong has nothing to do with it. I chose what was right for me and what I wanted for me. You have to choose what's right for you and what you want for you. It's not a matter of who's stronger. It's a matter of being informed of what your options are and then deciding what do you want? What do you need? And I fully support if somebody wants an epidural, because if that's what they want or what they feel they need, who am I to say, no, you shouldn't do that? That's not my
Right.
role. And so I think it's a myth that that if you're choosing medication, that it's not natural. Let's see, there are other
One more
questions.
question, yeah? One more question. Make it good.
Okay. So if someone's listening today expecting or knows someone who is, what is the best first step to take if they want guidance or support from you? So, again, I would love to have you reach out. You can reach out through my website or I'm on Facebook. I am on Instagram at MomRN is my handle there. I'm not as active on there. I don't post very much, but I do respond to messages there. Um, but through my website, I have a contact form, and usually that's the best way to contact me. Let me know what you're interested in or how you want to be supported, and we can talk. I would love to hear from you. Again, I offer in-person support throughout Oklahoma City and surrounding areas. But then I also have virtual options if you're outside of my service area. So we have lots of ways to connect and lots of ways that I can help you.
A well of information. I hear people call it you're a wealth of information, but I'm talking you are a deep well of information.
Thank you.
I'm always grateful for people being so brave to talk about how it's not a competition, about how women give birth. It's not that shouldn't be a thing. And I do
Yes.
love the communication that people can know that you're not in debate with the doctor, you're not in debate with the nurse, you are just advocating for the
Yes.
client, which is your client, which is their patient, when all everybody wants in the very end is a satisfied customer and a very healthy birth and healthy
Yes.
postpartum. So I just really think that this should be something that women should look into. So anyway, any last thoughts that you would love to give? Anything that maybe you wanted to say but you didn't get to say?
I just want to thank you so much for having me on and thank everyone for listening and participating today. And again, would just, love to connect with anyone that has questions or if they need support. And this is just, I could talk all day about about what I do as a doula and a birth educator and about all things birth. So I don't want to keep you here all day, but I want to thank you so much for having me on again, and it's just been a pleasure. And I love what you're doing. I love that you're providing lots of great information and just very blessed and honored to be a part of it.
It's the women's wellness journey. It comprises
Yes.
of so many different things. And what it's designed for is for women to know what's out there and for
Yes.
professionals to actually get to state what they do without having someone have to pay for a 3-day summit.
Mhm.
Let's just get in,
Yeah.
let's dive in, let's talk. So I am so excited. Thank you all so much, and we will see you at the next one.
Thank you.